In this audio lecture, we're going to be talking about hydrocephalus. So, hydrocephalus is an accumulation of cerebral spinal fluid within the skull. So, if you remember your cerebral spinal fluid secretion from Anatomy and Physiology 1, it is produced in the ventricles, right? So, it's produced actually in the lateral ventricles. So the secretion of cerebral spinal fluid can actually expand. It can apply pressure to the ventricles, which can apply pressure to the brain because it compresses the brain against the skull. Okay. Now, since these ventricles have increased cerebral spinal fluid, what happens is blood vessels end up being compressed. And as blood vessels are compressed, you reduce blood flow to the brain. And if you reduce blood flow to the brain, now you've essentially created a hypoxic or ischemic environment, hopefully not worse. So this pressure and this compression of the cerebral cortex, remember the cerebral cortex is where we perform many of our higher functions, so we have to have the cortex to have all those things that happen. And so if that pressure continues to apply brain to the cortex, it causes really neuronal death, and can cause severe brain damage if left really prolonged. If this is present, it's generally present at birth. It's not really common to occur much later, but we see that it's fatal if untreated. So it is caused by a disruption in cerebral spinal flow, right? So that there's two different versions of this. Either way, cerebral spinal fluid is impacted somehow. So you could get flow disruption, meaning there's stenosis of really a passageway. And remember, a cerebral aqueduct allows the cerebral spinal fluid to flow down into the spinal cord. If that is blocked or if it's narrowed, now it's going to impact drainage out of these ventricles and into the spinal cord, which could, if these ependymal cells are continuing to produce cerebral spinal fluid, then the fluid is just going to continue building up and more pressure, just like blood pressure. Or we could have what is called communicating hydrocephalus. And communicating hydrocephalus is when really the bloodstream is not actually absorbing the water. And so the bloodstream is responsible for removing the cerebral spinal fluid. And so if the bloodstream can't pick up that cerebral spinal fluid, then it serves the same thing as it builds up into the system. So generally this is associated with birth, but it can occur later due to central nervous system damage. Okay. So things that can increase the risk factors of this are prematurity or pregnancy complications, congenital defects, especially in the central nervous system, can cause this. So other causes or risk factors can include damage to the central nervous system. Right, this one doesn't have to occur before birth. This one going to occur later. So anything that would develop, so tumor development is going to impede the flow of cerebral spinal fluid. Central nervous system infections like meningitis. We'll talk about some of the other infections in these later on lectures. We could have a cerebral hemorrhage, which we have a blood vessel rupture. Now this is going to in turn be directly applying some of this pressure, and then severe head injuries. Right, so severe head injuries can cause this hydrocephaly as well. So, like I said before, it's fatal if untreated. 60% mortality rate if untreated. So it's a really high fatality rate, and then it's really the severity of it depends on the diagnosis, and that early treatment is initiated, and then comorbidities that are also associated with the worsening of this disorder. All right, so we have a number of manifestations that are included in this hydrocephaly, and both of these manifestations would be present in children and adults that undergo hydrocephaly. So anytime you have increased pressure on nerves, you're going to experience more nerve action, and more action potentials to be sent. So it's pretty common sense that we would find headaches as a manifestation. That seems general, but it's due to the increased pressure on the nerves and really the overstimulation of the nerves. Nausea would be associated with that as well. Blurred vision could be due to a couple different things. So increased pressure on the retinal nerve that is going back, entering from the eyes, and then also pressure on the occipital lobe. So both of these regions could end up resulting in diplopia, or blurred vision, as it's otherwise known. We could have a slow pupillary response, since now, so we're seeing some eye-associated disorders, and so these individuals are going to have, due to the pressure on the optic nerve and the occipital lobe, so we have sluggish response to the slow pupillary response to lights, and so normally we see them contract pretty quick if we shine a light in there, and we might not see that happen as rapid in this case. Now we lose control of our motor skeletal muscle fibers that are controlling eye movements. Now uncoordinated movements would be a different thing, and that's going to involve really the prefrontal cortex here, and specifically the motor cortex. So the precentral gyrus is going to be where we generate the efferent response for movements. So really increased pressure is going to generate more action potentials from that area on the nerves, and maybe not when you intend to send those action potentials. Due to the increased activity on the nerves, meaning resting membrane potential is constantly being disturbed because we might have firing of these neurons, okay, is going to result from a depletion of ATP. Some additional manifestations we could see, we could have really mental development really slow or regress even. Memory loss would be a understandable characteristic of this. So if you apply pressure and then you reduce the blood flow to that neuron, if region of the brain, and it dies, then you lose really function of that part of the brain. Okay. Confusion would be an understandable manifestation, and then additional manifestations are going to deal are really going to vary quite a bit. But we have urinary incontinence, meaning the individual probably loses conscious control of their bladder. It's not the typical type of urinary incontinence. This is going to be due to nerve damage and brain disorder, right? So now really you lose the conscious ability to control your bladder. Irritability, because nerves are going to be hyper excitable. Personality changes is going to fall under the same category, and then impaired performance in school or work. And so individuals would probably fairly quickly regress as far as like performance and mental abilities. So how is a hydrocephalus diagnosed? Really, so this is going to be a patient history and physical examination, just like every other condition that we've talked about. But in this physical examination, we're going to include a measurement of the head. So we're going to expect that somebody with a larger head and that is suffering from really some of many of the manifestations are going to be prime candidates for this hydrocephaly. So we might do a neurological assessment looking at the electroencephalogram. And so that's going to look at brain activity. And so some additional things, tests that we can do in the clinic to help diagnose this is do a head CT scan, do a head MRI, a head X-ray. All these things are likely to show the swelling of the brain or the increased cerebrospinal fluid pressure. Now, to take advantage of technology, we're going to look for this prenatally, okay, looking for a fetus that has a larger than normal, what we would expect head. How is it treated? If it's due to a blockage, so let's say a tumor is growing on the path of the cerebrospinal fluid, then they remove that tumor and try to ameliorate that impact a little bit. Now, if it's just a natural stenosis of the cerebral aqueduct, they might go in and they might bore out a slightly larger hole, hopefully not causing too much damage in the process. They might even place a shunt, so allowing cerebrospinal fluid another direction to go other than continuing to increase in pressure. Now, if this hydrocephaly is due to a bacterial infection, then antibiotic treatment is going to take place. This is an endoscopic third ventriculostomy, right? And this is going to be when they insert a hole into the floor of the third ventricle. So this is the third ventricle right here. Assuming that this is where the cerebrospinal fluid is building up, they'll insert another hole there, and this allows the cerebrospinal fluid to leave and move down into the spinal cord. You're never going to go without medical treatment for life. This is going to be a lifelong condition, and that they're going to have to continue looking out for, making sure it doesn't pop up if it is treated. And then we're also going to have a multidisciplinary team to take care of the multiple manifestations that we see. So we're probably going to include occupational therapy, physical therapy, anything to get the patient back on their feet. All right, so this is the end of the lecture over hydrocephaly. I hope you enjoyed it. Stay tuned for the next audio lecture.